Ronnie Sullivan's parents have so little to hold on to. Their baby, stillborn in June 2020, a few hours to cuddle, to say hello and goodbye.
There's not a day that goes past that I don't think about him. I just constantly feel like heartbroken.
Connie Copperthwaite-Jackson was just 20 when she was pregnant with her first baby. Towards the end of that pregnancy, she was worried something was wrong.
If I'm going to my midwife, if I'm going to every health professional that I do speak to, and they're telling me it's nothing to worry about, what more can I actually say? It's trying to battle with someone that is a health professional. To be quite honest, I don't really have a clue what I'm talking about when it comes to them things. I'm not a midwife, I'm not a doctor, but that's my body and that's my baby, and I knew that something wasn't right, and I just wished that someone had listened to me, because maybe, I do think that he would still be here today, I do.
An internal hospital report said Ronnie died from hypoxia or lack of oxygen, most likely, it says, because her placenta had abrupted, pulling away from the wall of the uterus. It also highlights missed opportunities to detect possible pre-eclampsia, a condition which causes the mother's blood pressure to rise sometimes dangerously high. Ronnie was born at Basildon Hospital, part of Mid and South Essex NHS Trust, into a maternity unit that had been at the centre of whistleblowing allegations. In 2020, the Care Quality Commission, the CQC, issued a warning notice. The report said 6 serious incidents occurred in which babies were born in a poor condition between March and April that year, starved of oxygen and at risk of brain injury. The CQC visited the hospital just 2 weeks before Ronnie's death and subsequently rated it inadequate. They found the service did not always have enough staff to keep women safe, and staff did not identify and escalate safety concerns appropriately. The long-standing poor staff culture had created an ineffective team where doctors, midwives and other healthcare professionals did not support each other to provide good care. What's happening in the maternity unit here is happening across the country. Too few staff, a high turnover, and the staff who remain feeling unsupported. But what about the families? What about those parents who come here to give birth, and when it all goes wrong, what they're telling us time after time is that they feel they are not heard, they are not listened to. Certainly Connie still doesn't feel heard. Since Ronnie died, she has been asking the hospital to find the baby grow she'd dressed him in, but it remains missing to this day. The Trust did not answer our question about this.
He was in that outfit for a few days, so for me, obviously I'd never be able to smell him again, get to hold him again, and for me that was an important thing to have handed back to me. As if I didn't already go through a lot, that made me feel closer to him, would have made me feel closer to him.
There is now a long list of maternity scandals in which babies and mothers have been harmed or died. Nottingham, East Kent, Morecambe Bay, Shrewsbury and Telford. The parents are articulate in their grief, but sometimes the figures speak loudly too. Last year, following an investigation, Channel 4 News revealed that Nottingham University Trust, for instance, had recorded 15 claims for deaths over a decade at its maternity units. They have fewer births than Mid and South Essex NHS Trust, but data from NHS Resolution, also obtained by Channel 4 News through a Freedom of Information request, reveals that over a 10-year period, the Essex Trust recorded claims for 36 deaths, proportionately far higher than Nottingham. They also recorded 27 stillbirths and 55 babies born with brain damage or cerebral palsy. So far, they have paid more than £103 million in damages for 176 claims.
They don't seem to be learning from lessons where mistakes have been made previously. And I think there's lots of reassurance that they will learn and they will make changes, but these criticisms still keep coming up. Despite all the visits by the CQC and the multiple visits by the CQC, they seem to be finding the same issues time and time again.
One of the most high-profile cases from Basildon was the death of Gabriela Pintilie. The 36-year-old died in February 2019 after losing 6 litres of blood following the birth of her daughter. A coroner said there were serious failings in her care and that she was not given blood products that were, in fact, available.
Bravo!
Her husband, Ronnie, is left with their daughter, Stefania, now nearly 3, and 17-year-old son, Robert. And he is no longer with his childhood sweetheart. Ronnie doesn't speak English, but it didn't need an interpreter to tell us that this was a man absolutely bereft.
Câtă durere în suflet pot să am eu ca părinte și imaginați-vă alte familii care prin această chestie se pot distruge. Cea mai bună soție, cea mai bună mamă, echilibru meu, iar eu echilibru pentru ea. Și cea mai pură iubire.
Mr. Pintilie now wants an independent investigation, but he also levels a serious allegation at the trust.
Să consider cumva, sper să nu greșesc, dar cred că cumva probabil și rasism, după tot ce s-a întâmplat,
Why?
pentru că ne-a întârziat și nu ne-a luat în calcul și nu a luat cazul soției mele în serios, că trebuia să nască mai devreme. Dacă făceam scandal, țipam, urlam, poate eram luat în serios.
Using Google Translate is not sufficient in these circumstances, and often in an emergency situation it's very difficult to find somebody to be able to speak to the patient, and I think this is a common thread actually, because a lot of cases that I have where things have gone seriously wrong and there are brain injured babies or there's been a stillbirth, they tend to be patients and relatives who do not speak English as their first language.
The Trust's CQC rating now needs improvement, a step up from the previous inadequate rating. But once again, staffing issues were mentioned in the inspection report, the staff themselves saying they were frustrated by this and overwhelmed. In a statement, the Trust said,
"Our thoughts and deepest sympathies go to both the families of Gabriela Pintilie and Ronnie Sullivan. Both cases have been fully investigated as serious incidents, and we've made sure that the Trust has learnt and continues to learn from these events. Over the last few years, we've made improvements to our maternity services, including recruiting 40 newly qualified midwives, a consultant midwife, practice development midwives and maternity care assistants, and securing almost £2 million in funding for the further recruitment and development of staff."
Connie and her partner have now had another baby, a little girl called Angel. Not a replacement for her brother, of course, but a comfort for her still grieving parents.